Slip and fall cases, obviously, especially when you live here in Minnesota, or we're handling cases in snow and ice related areas. The ones that we see a lot are going to be shoulder, rotator cuff tears, maybe fractures where I slip and put my hand out. So I fracture my arm, it could be any part of the arm, but oftentimes wrist and or the lower part of the arm, which is a radius in the ulna. Ankle fractures where I slip, roll my ankle, or I fall in it awkwardly. Maybe I tear either my meniscus or I tear my ACL or another ligament in the knee. The other one we do see on occasion, although less probably than the others, would be what's called a labrum tear or a labral tear. Can be in the hip, can be in the shoulder. But those injuries, when people slip and fall, normally when they slip and fall, they do so because there's some sort of an awkward movement and then they land wrong. So the ones I think, if you're going to just look at body parts, ankles, knees, hips, either lower part of the leg, maybe sometimes too, where you have a fracture. But those are the common ones. And then maybe another that I haven't mentioned otherwise is when people fall and hit their head. So concussions can develop out of slip and falls. And any one of those injuries can happen when you slip and fall. And any one of them can also be very significant. We see slip and fall claims where some of the fractures are absolutely horrible. Injuries are just where you have displaced fractures, or maybe what's called an open fracture where the bone goes through the skin. Those are significant injuries. And when people slip and fall, we love to help them. And we've handled many of those cases. And as winter approaches, I suspect we'll be getting many of those calls sadly soon.